call this meeting to open. And I have with me the Pro Temp Hogan, Counselor Nave, Madam President Hudson, Counselor Piniagua, myself,
Michelle Spansky, Deputy Commissioner of Neighborhood Development, and I have here also Sue McMahon, who's our Emergency Solutions Grant Director.
all right. Just wanted to go over some of the ask for the programming, and so if you could just give us a little background on how the program came about and how the ones that were chosen.
Yeah, absolutely. So obviously kind of this particular item is to talk about the disbursement of funding that we are getting that's made available to the city of Syracuse to the New York State Attorney General's office to deal with the impact of opioid related conditions here in the community in Syracuse. Just to give a little bit of kind of scale to the problem of opioid use nationwide from beginning in about 2020, deaths related to opioid overdoses have increased about 45% in the entire United States. In the last decade here locally in Onondaga County, we saw an increase in opioid-related deaths up about 250% during that 10-year period. Really kind of seeing a big uptick additionally again in the period between 2020 through 2023. Understanding kind of the impact of the pandemic, really intensifying kind of experiences that people were having if you were already struggling, losing access to available resources and services at a time when the uncertainty of the pandemic with increasing kind of the loss of access to those resources added a lot of additional challenges that we're still seeing. We had a total of about 1,300 deaths during that same kind of 10-year period. So it's a very significant problem that we have here locally. We also know that it's something that is disproportionately impacting Black residents in Onondaga County. Black residents make up only about 11% of the countywide population, but have accounted for about 15% of opioid-related deaths. So there's a significant public health impact that we're seeing here, with particularly in 4 key zip code areas that fall within the Syracuse area. So these funds were made available, as I said, by the New York State Attorney General's office. They're being managed through the Office of Addiction Services and Supports, and they're related to settlements that took place against pharmaceutical companies. So as with other programming that the State Attorney General's office has done in the past, when they have had kind of major lawsuit settlements, they have done a really excellent job of making those funds available to local municipalities to help them kind of deal with and mitigate the impact of those challenges in their local communities. So this $1.4 million of funding we've received is for this current 2-year period. We do expect that there's an opportunity to get additional funding over through a period of about 10 to 12 years. But the exact amount of that is going to remain in flux kind of based on what comes through at the state level. So this is the first kind of tranche that we have to work with. As with any grant funding that we have that becomes available, we put out an RFP, request for proposals, for qualified agencies to submit proposals for different types of programming. The RFP identified 2 strategic priorities for how those funds would be spent. So focusing in particular on prevention. So how do we kind of prevent overdose deaths and really kind of prioritize harm reduction. And then additionally, treatment. So how do we help connect people who need services to those services and make sure that those services are well matched to what their needs are. So under the prevention category, basically any agencies that were, particularly ones that were looking to do kind of mobile outreach to reach folks, not understanding kind of that people are in a whole number of different places, not relying on them just coming into your kind of physical location, but how can we kind of reach you where you're at? And then under the treatment category, really trying to think intentionally around how can we work to support crisis centers as an alternative to ER visits, and what can we do to kind of alleviate some of the impact that opioid use is having on our emergency medical systems and first responders. And then how can we work with those emergency medical system responders to kind of respond in the field, and then also make sure that we're making the appropriate connections kind of to longer term services for treatment. So In terms of kind of eligibility to apply, basically any agencies that are working and providing services within the city of Syracuse were eligible to submit proposals. There was a total of 6 that moved forward with those proposals, and everything was evaluated by an RFP committee that was made up of a combination of staff within NBD, service providers and experts that have kind of that technical expertise working in the field, representatives from the Division of Purchase, and then there was 2 Common Council representatives, Council President Hudson and Councilor Hogan, that also participated on that evaluation committee. In particular, the committee was looking to see that the agencies for the programs that they were submitting, that they were aligned with kind of those strategic funding priorities that I laid out within the prevention and treatment categories, that the agencies had the fiscal capacity to really support that work, and that they had the programmatic expertise and staff expertise to be able to manage implementation appropriately, and that those really kind of have had a track record of success in doing similar types of programming before. Looking to see the extent to which those programs were promoting different types of community collaborations and leveraging a network of other service providers, not necessarily trying to duplicate services, but what can we do to kind of complement and fill existing service gaps. And then the extent to which those programs would be evaluated and kind of what their tracking and evaluation processes looked like. So that's just kind of a high-level overview of the process that we went through on our end. I'm happy to give kind of a little bit of an overview. I believe you all have descriptions of the particular programs that were funded, so 4 of the 6. I can talk through those if that's helpful, but if there's other particular questions, I'm happy to speak to those as well.
I have a few questions. So, well, I wanted to comment on one thing that you just spoke about as far as like the ER, decreasing ER visits. I'm not certain if what all of them do, but as far as Helio goes, I am aware that Helio, if someone comes into their program new, say someone brings them in or they just come in on their own and they have taken substance relatively soon. That's around the time they got there. And if they have fentanyl in their system, Helio sends them to the ER. So I don't know how that is reducing any, and then there's no real follow-up. So if someone's coming in for help and you send them away with no follow-up to come back to you right away, that's negates the situation, because then the people are put back onto the street per se. So I'm not sure if that is being addressed.
And historically, that's how it's always been. But luckily for our community now, they've just opened up their stabilization center, which you can go 24/7 if somebody has is exhibiting symptoms or come in, they're asking for help, and they have medical staff there that will keep them and hold them for 24 hours, and then take the responsibility of referring them on. But one of the programs that we are wanting to fund is through Helio, where they will take it to the next level that our community's been desperately needing for so long. Because these folks will go out into the streets, find the people, they will develop relationships with them, they will case manage them after they have their incident, they're on their caseload, and during downtimes, they're basically gonna be walking the streets, reaching out to the folks where they know where they are. But you're right, that we have really, our community's really missed out on that extra step that makes the world of difference. Like after somebody, does overdose, to let them go and not with
It's
the
not
follow-up
even necessarily an
services.
overdose if someone comes in, but it's in their system, because Helio doesn't know what amount is in their system, so they send them to the emergency room unaccompanied by someone from Helio. So once they're released from the emergency room, they do not return to Helio. So now they're back out using drugs.
Yeah, it's my understanding, and this is, the stabilization center is brand new. I went to the grand opening and they reviewed everything, that's supposed to help with that. Nobody will, because since they're gonna have doctors there, they can treat them there unless they're really overdosed or they need assistance with breathing and things like that. I think then they might be transferred over there But, I'm real excited about, working in the field for years and years. And we've always missed what you're talking about, that this is and it's the first stabilization center in the state that's open. There's going to be, I think, 3 or 4 other ones around the state. And so they're basically, giving it a lot of attention. They're under a lot of scrutiny, for the success of this. And, I'm really positive that this is going to make a big impact. I can't tell you for sure offhand, but it was pretty good. They have one even, a section for just children. And then and this is for stabilization, not only for drug use, but it's also for mental health crisis. And so, but it was pretty big. They had, quite a few, beds and things like that.
We can confirm an exact number and follow up.
Yeah. Yeah.
And you just brought up children. That is one of the greater needs for youth or young adults who are who are looking to go into recovery. Having their own safe space. Did anyone here outside of the new center have anything for that? Because I know that there's younger adults who have seeked recovery, and outside of going into a facility for up to 30 days or more, returning home, they don't really have a place with people of their own age, per se. Normally, much older individuals are in recovery. So did any of them have anything for youth, maybe 21 and under?
I know that with like the Helio program, just going through these, that they will do youth, they'll do anybody, it's just anybody, because there wasn't like a definition of an age group. It wasn't like only adults, it's like whoever was in need for substance use support, is what they were focusing on. But, I'm trying to think.
Justice Innovation Program, I think one of their particular emphasis is they have a little bit of a geographic base, but they are looking to prioritize kind of peer support navigators, and really kind of within their staff hiring, making sure that it's representative of the age groups and different folks that they're working with. So again, not perfect, but it is something that several of the programs kind of had elements of that, just doing what they can to kind of align people that are as similar to the people that they're looking to serve as possible.
Well, maybe not this year, but if it was to be refunded, that should probably be something that we prioritize, that there's some type of treatment, where youth are the center.
Sure.
Any other questions around that?
I do have a question. As part of the grant process, was there a requirement for language, a language requirement, other than the telephone? Because if you have somebody on a crisis of that nature, definitely you will need a live interpreter in the room.
You're asking in terms of kind of the services being provided? So
These people that are going to be granted these dollars, do they have a language component within the services of the grant?
So any of the ones that are working through kind of any of the emergency medical systems, a lot of those are going to have inherently kind of the same connections, any language line services or interpretation kind of on the spot there. I think between each of these different agencies, I know, again, Justice Innovation has a very, very strong multiple staff within their team that speak different languages here within the community. Based on the West Side, several Spanish speakers. For that particular program, County Health, same situation with their programming, obviously have access to all the same interpretation resources that we would have here locally through Language Line and potentially some additional other ones, I think, kind of.
But they're obligated to do that?
Correct, yes.
Oh, okay, that's my question.
Yes, yeah.
Definitely.
Can I ask you a question? What about the outreach programs? Because people with drug and alcohol abuse are not going to come to you. Do you have outreach programs within neighborhoods? and you can
Yeah, so that's
explain
exactly
you-
what, so several of these programs are working to do. So the program that the health department is running is doing outreach. Justice Innovations program is prioritizing different outreach. Helio Health is prioritizing outreach kind of through like as calls are coming in through 911. So
Are you going into schools or neighborhoods, or where you feel that there is a need?
you want to speak to some other?
There is. See, prior to us doing this RFP process, I was part of the county got a lot more money than the city did. And so we were in trying to figure out what we wanted to focus in as a city. We used what type of programs the county was doing so that we know, okay, they're doing those, and so we're doing these, and what's our biggest need in the city. And they have a program that is going into the schools for education, for, drug use, so that is being done with the opiate funds in our community.
And do you ever find out what the root is when, any addictions? When you speak to clients, you ever find out, well, what's the root of it? How they got addicted. You ever ask those questions or no?
Well, I think they're asked a lot. I mean, there's many scenarios, but,
Okay.
The idea is that these partners are working to connect with the appropriate kind of mental health counselors too. So obviously there's a interwoven relationship there, and the goal is to get everybody into the programming and kind of long-term care and support. So
And they can come back to Helio for any follow-ups necessary?
absolutely.
Okay, thank you.
I want to touch on something you said. You said the county has a lot of money, right? And I'm going to say this because a lot of the folks that's going into our city are going in from the county. So I expect that we could look for a little more help from them because they're not all city folks that we're dealing with this crisis. And then I want to say that I have a drug addiction son, so I do know how this works, okay? And I know that there's a lot of folks that have cross addiction. So how are we dealing with dual addiction? I know right now, and these are good programs, I said on RFP, I get it. But I know that we need to look in a deeper dive into this because Upstate has a clinic to where they treat cross addiction, and they do have inpatient. Have we even, I mean, I know they can't, the capacity is not that great, but is there a way that we can kind of maybe tap into them and talk about the cross addictions that these folks have? Because everybody's not just doing opiates, they're doing more than, they're doing a couple of different things.
I believe that that Helio Health definitely treats multiple addictions, dual addictions, whatever, including, mental health, many drugs. I think to get to the root problem of it, of why they're using, it's just what's your drug of choice today.
I get that. I mean, because you're never going to get to the root problem. The root problem for some people might be something that happened when they was 3. So there's no real reason to say, okay, can we figure out why they're doing drugs? It's a choice they made. I get that. They're addicted. I'm addicted to cigarettes. It was a choice I made. So we just have to not, keep ostracizing these people because that's what we do. We just need to figure out a way. We're not going to stem it all, but we need to try to reduce the numbers. And when we have a thorough program that covers everything, I think then we'll start being able to see the reduction in numbers. Because everybody don't want to quit. Some people do, some people don't. So everybody's not going to quit. Everybody's not going to get help.
I think with several of these agencies, the idea with them is that although kind of the opioids is the entry point for this particular funding opportunity, a lot of these service providers that are receiving these funds are also the same service providers that are doing other different types of mental health supports and behavioral health services within the community. So again, it's not a perfect system, and I think that there's any number of different places for opportunity for us to kind of collectively keep working with the agencies and healthcare systems that are working on these. But the idea is really that kind of just because your entry point may be opioid related use, that doesn't mean that you're going to be excluded from services for any other different types of use disorders that you might be dealing with or mental health issues.
Hope that we, like I said, take a deeper dive because I'm just going to say it because it's the way I feel. I think that a lot of these programs that's geared from the state and the county, they're very discriminatory because opiate use is basically A lot of people are using it, but more people of color are using spike. But nobody's addressing that issue. So we're stuck on opiate, but the spike is just running out of control, and nobody's touching that.
What we did in the wording of the RFP is we had to put down for opiate use, but then we added any other drug use. So that means that anyone who's funded by the city has to look at all, it doesn't matter what drug. If it's drug, substance use is substance use. So we made sure that that was in there.
Council President Point, do you have, as part of the services that you would offer, do you include like a family component? Because sometimes, bringing the family in and dealing with these issues together as a unit may help.
Yeah, there is a family component for the Helio Health Program where they go in when they do the follow-up services, that they are going to, also do any kind of family counseling along with the client counseling. So they did include that in their RFP.
This is indeed sort of disheartening, to even have a committee meeting like this about this issue, because it's so prevalent in our community. And I've seen different programs, come to the forefront. Now I'm wondering, in something like this, because of the, amount of money that we're going to spend, is there going to be some sort of follow-up measurement? Is there a measurement of success on something like this,
Yeah.
or what?
We're going to do once, they're awarded, they'll get their award letter. Then we're going to do a scope of service. We're going to sit down with them and come up with measurable goals so we can determine success. Because then in 2 years, when we'll have our next batch of funding, we want to only fund the successful programs once we've made a big difference. And and we have opportunity, possibly every 2 years to change our focus also.
So all of the agencies, essentially, as with any of our other funded programs, are all required to be doing ongoing reporting throughout the duration of the award period to us. We have ongoing check-ins with them to discuss kind of any performance challenges that are coming up and address those issues. Obviously, we want to work with agencies to address any deficiencies that there might be, but the agencies that are not performing and not delivering services are ones that we would look to evaluate whether, if they apply again, whether they should be receiving those funds.
Yeah, you're right, obviously, and you do have some sort of like measuring tool, but for something like this template for a measuring tool would probably be way more difficult. How you determine something like this new program you talked about, this Justice Innovation Peer Navigator thing. How would something like that, how would you measure success?
I think kind of working collectively with other kind of public health providers that we have here in the community that are looking on an ongoing basis what the rates of usage that we're seeing of opioids is in the community, what the rates of overdose from opioid use disorders are in the community. All of those metrics are things that are tracked by the health department, and that the health department is obligated to be reporting to New York State. And so I think kind of collectively as a community, it's not difficult, and it's incumbent upon all of us to be looking at those numbers and making sure that the programs that we're funding are aligned. And if we're not seeing numbers go down collectively as a community, it's an indication that we need to think about doing something differently or doing something additionally to address those issues.
Really quick about the Justice Innovation Center, because I don't know them, and it's basically like says West Side Community First. So is that centered primarily on the West Side? Is that the neighborhood they serve?
So
is that because of like language?
Yeah. Yep, they're located at 601 Tully Street, so previously called Center for Court Innovation. Here they're referred to as the Syracuse Peacemaking Center. So I think they're
so they're an adjunct of the peacemaking?
They are the Peacemaking Center, basically.
So it's the same thing?
It's the same thing, yeah. Okay. It's a little bit of a confusing branding change.
So they're a multi-tooled organization?
Correct, yes. So based on kind of their role on the west side, that's a big thing that for the residents that they're serving, opioid use challenges are something that had been expressed very widely of community residents there. And so kind of understanding geographic proximity to the rescue mission and other places, that's the reason why that programming is kind of particularly targeted within the 12304 zip code area.
They're pretty plugged into the west side, so that's.
Every day there's new organizations cracking. And there's one that the overdose. And so she's trying to work with families and children that are doing drugs to kind of work with them to get them to, remove it from their life. So there's places that's here now that may be another innovative way for us to start looking at how to deal with this.
Certainly.
Sharon Owens, Deputy Mayor, and Council President. One thing that was pointed out is that we'll take a look at who does well, look at those metrics, and see how the agencies did, but also take a look at what gaps we missed. One thing, and there were parameters that were provided to us as the grantee from the AG's office. If we can, within those parameters of the next tranche of funding, maybe set aside, because again, most times in RFP processes, those who have capacity to write grants. But there are also neighborhood-based organizations or groups that could provide, on a smaller scale, some very targeted service. So if we can, within the parameters of the guidance we'll get from the AG's office, set aside dollars and maybe have a pool for some of those smaller organizations you're talking about that are very targeted and reach a population that may not be comfortable going into Helio.
Say that because the population that she's serving, they're not going to talk to Helio or the rescue mission.
Yep.
But they'll probably talk to her
Yep.
because they had a connection to her kid in some kind of way.
And in the next RFP, we could look at a requirement or a priority for organizations that make that kind of partnership.
That's what I was wondering.
How did people know about the RFP?
Yeah, our RFPs go through the procurement process that we have. Because Sue is on the ground, she will make sure everyone knows that really works in this field. Again, the problem with RFPs is the capacity of the people who would like to write for them, whether they're an organization. I think we should do a better job of helping people understand that there can be fiscal sponsors for RFPs, so that's on us to do some more work in that area.
I give Rebecca Lumpkin her credit because she's been working real hard to
Yep.
try to find these side groups.
Yep.
And kind of try to help them work through this process. Because it is very cumbersome. And Helio and Rescue Mission and all these folks, they're going to continue to grab it because they're expert
And they
writers.
have grant writers, right?
So they can do
Right.
that. But there
Right.
are organizations that may be experts, but they don't have the capacity.
Yeah.
They just do the work.
Yep, we are very capable of finding the sweet spot because we're still accountable for the money and making sure it's spent appropriately. But in the next, because she's still acquiring these funds through her process. So in the next, we've been told we're going to get more money. So a couple things we'll look at is we'll see how these agencies do. We'll see what gaps we're finding we're not meeting. We'll also see about in the language actually encouraging partnerships. I've seen RFPs where we've had to subcontract, and it was said in the RFP that 30% of the money had to go to a grassroots organization. So there's kind of things we can do with that language. This was our first round at this. We want to be successful. We want the AG to see that we're successful, so she continues to send money our way. Because the need, as Councilor Hogan said, it's sad that we have to have this conversation, but it is huge.
You know, and I think we have to recognize too, and I'm glad that there's significant outreach too, because many of the folks I know of the rescue mission, as far as the shelter, the 2K, I mean, a lot of those folks who are out the street,
Yeah.
they won't go to shelters because they're scared of shelters.
They're scared to go there. The relationship with, what's the name of the organization on the west side?
Peacemaking Center, Justice
Yeah,
Innovation.
they specifically wrote in their application the relationship they have with the rescue mission, because it's no secret to all of us, all of the troubles and the challenges we have over there. So we're really over there in that area with Helio. We're up on the north side. Eventually, we'll have organizations that are on every side of the city, but right now, that's where we are.
Even Hudson's Point, the community folks,
Yes.
people in the community.
Absolutely.
My point was, we're spending this money to fight this crisis. Like, look who's fighting against us. We got these convenience stores, they're selling illegal drugs, just a vape shop, I had a store owner call me 2 weeks ago as to why Code shut him down. Would not go into details to why. Said had to do a permit. Finds out they're selling Spike. So I'm waiting to meet with his attorney, driving in from Rome, and all of these people are coming. Aren't you open? Aren't you open? They're not there to buy some convenience food. They were trying to get their Spike. And this is what we are having. We're fighting against these convenience stores. Every so often, they want to open up a business. And while we're trying to get them off these drugs, they are there to promote their drugs. And so we're up a battle against these convenience stores. And I see it in my district. I've confronted these vape shop owners, and I've told them, no illegal sales. But they'll say, well, I don't speak English. I don't understand you. I say, you understand what's going on.
The law's the law, and I commend Corporation Counsel, Jake Dishaw, the police department. They've put together an entire squad to go after these places. The other dilemma we have is that we shut them down and they go open up or under another name.
I went over to Woke Vape, and then the second time they got shut down by illegal cannabis. And I spoke with the owner. I said, we can't deal with this, all right? They don't care. They just want to shove their drugs. And this is our battle we have right now.
Not to cut you off,
No.
Marty, but I've been thinking a lot about this because it's been a problem. And Councilor Hogan knows that when we had the issue with the water, the formaldehyde, we wrote legislation, and we might need to open that legislation up. And look at it and start including some of these drugs into that legislation.
Thank you.
Well, I want to commend the administration on their action on Geddes Street, those force traps on Geddes Street, which was, it sends a message.
Counselor,
I think we got to keep on sending that
it is
message.
like whack-a-mole. Get one, pops up somewhere else, but we're going to keep doing the work.
All the resources of the city and as far as enforcement, especially on those stores, especially
Right.
like on Geddes Street where you're so
Right.
close proximity of Fowler High
Geddes,
School,
Butternut.
you know.
There
and
multiple
Butternut too, right?
places.
Yeah, so.
Thank you.
My next question is the 7.5 admin fee. Is that a standard admin fee that you guys charge across the board?
It's actually a lot lower than what we totally could charge. For some of our other programs, CDBG, for example, allows us to take up to 20%. So it depends on the exact fund source.
Yeah, 7.5 is the lowest, of all the choices. I reached out to Oasis myself on that, and we could do up to 20%. But for ESG, we do 7.5%. So we went for the lowest.
That is 7%, not of each contract, but of the whole allocation.
Yeah, yep, I saw that. All right, because I guess, let me go back. Okay, so I guess we had a little questions around the Justice Innovation Center, but I understanding that they are a grassroots, newer organization, so I guess that's a little understandable. Okay.
So when you guys get your reports back from how the progress is going,
Yeah, certainly happy to share that.
A few of my questions were answered through some of the conversations, so I didn't have any more. Anybody else have any questions? No? All right. So that concludes this meeting. Thank you. I appreciate it, and we'll follow up.
Oh, yeah?